Golden State's injury-plagued season continued last night as Moses Moody went down with a gruesome-looking knee injury suffered on this play. In this video, we'll take a closer look what exactly we were seeing on the replay and how an injury like this occurs. Welcome back, everybody. I'm Dr. Brian Suter, and the goal in this channel is to teach more about the medical side of the sports world. So a really serious injury here for Moses Moody, and we're going to talk first about what led up to the injury and then look at the replay where we saw that clear kind of deformity, kind of abnormal positioning of the outline of the knee. As he goes down here for this fast break layup, it's really this step right here with his left where he's loading eccentrically. So in this position, as he's going down to kind of coil up the muscles to store that energy to explode upward with that concentric firing, this lowering down to the ground is an eccentric muscle activation. His tendons, his muscles are lengthening as he drops into knee flexion, specifically across that extensor mechanism with the quad tendon, the patellar tendon. As he then goes to explode upwards, there's going to be this sudden violent concentric contraction as he tries to explode up off the ground, and that's going to be when the injury occurred. You can see as he's up in the air, he kind of flails already, goes down, grabs at that left knee. From this view straight on, again, we're looking at that left leg, normal step right there. He starts that eccentric load, he goes to concentrically fire, and then we see that knee just completely give way as he goes down.
Bro, it's just so fucking unfortunate, bro, because he wasn't even trying to do nothing flashy, bro. He wasn't trying to do nothing flashy. He was just trying to take it up for a regular dunk. And the question is that, like, do you think this comes, like, because, like, over workload, like, just over working the knee or whatever that day and just, like, not enough rest time?
Where's the court? Now, we don't see any quite clear positioning. Actually, yeah, we do. So as we're looking here, we do already see that abnormal positioning. And what I want you to pay attention to is the contours of the bone, because that will tell us about what this injury ultimately is. And right here, what we're seeing, this faint little glimmer, this kind of reflection, is going to be his patella that's been displaced superior up the thigh because of a patellar tendon tear. What we're seeing here with this image, as Moody was uncovering his knee, we could very clearly see what happened. What you're looking at here, down here, is going to be the tibial tubercle. So this is going to be the shin. The knee joint is roughly across about this area.
Bro.
The quad, of course, going up this way. And so this contour that you're seeing right here is the contour of what's called the trochlea. Trochlea is the groove in the femur where the kneecap slides back and forth. And so you're seeing this rounded contour of the trochlea. This is going to be the medial femoral condyle.
I gotta speed up. I can't even look at the screen,
see how the skin is being stretched in that area, and the patella is up in this direction. Normally, the patella, which is
out of respect to Moody too, I'm not
in that trochlear groove. What keeps
it's an educational video, but
patellar tendon should be running right across this location down to that tibial tubercle.
Rocky, I'm not even looking at the screen, fam.
Exposed trochlea because the patella has displaced superior because of almost certainly a patellar tendon rupture. If you look at all these different structures around the left knee, of course, I've got the patella that is still shown.
Prayers of Moody, prayers of Moody, man.
Position where the patella should sit, roughly at about the level of the joint line, probably a little bit higher up. What we're then going to see, those condyles, those rounded condyles I talked about, are going to be this contour right here, diving down into that contour right there. And so if we take our patella and we hide our patella, the kneecap, hide the cartilage behind it, this groove that we're seeing, this flattened kind of contour right here, is what we are seeing on this replay footage with Moody's knee. We're seeing that rounded contour because the patella is not sitting there covering it like it normally would right here in this area. Patellar tendon coming down here to that tibial tubercle. Patellar tendon ruptures. Patella displaces superior, leaving uncovered and exposed that trochlear groove, to where now that's what we're able to see to say, yes, this was a patellar tendon rupture. If this were patellar dislocation, his patella would be sitting off here more lateral, but it still is midline. It's just elevated. You can see that, of course, he was being taken off on a stretcher. He's got a little bit of immobilization around that left knee to help support it, keep it straight. This isn't like a limb-threatening sort of an injury, but absolutely something that's going to require surgery and could start to creep into next season. It will definitely keep him out at the start of next season, but oftentimes this is a 9-month, potentially year-long recovery for a basketball player. And so very, very serious, very unfortunate, but hopefully that helps you understand the anatomy of what we were seeing. Remember, tendons tend to fail when they're put from that eccentric load to a sudden concentric firing. Achilles tendon, somebody's backpedaling, they stretch the tendon, they explode off, it tears. Similar thing here. As Moody was going down the court, he's essentially stretching that tendon. So in this position, if we back this up a little bit, this step right here is putting some stretch through his patellar tendon as he goes to plant, explode, but then that violent concentric contraction is what causes the tendon to fail, and there was probably some degree of underlying patellar tendonitis already there. The tendon was probably a little bit abnormal to begin with, making it weaker, more predisposed to something like this finally happening. That's it for the video, everybody.
Damn, man. This is sad, man. Prayers to Moody, man.